Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kosuch. Hello, everyone. Welcome back to another episode of Patient Journey Pioneers. I'm your host, Liat, and today's pioneer is Professor Sam Shah. Sam wears many hats in the industry, so I'll let him introduce himself.
Well, very excited to join you today and great to speak to you. So a bit about me. I am the Digital Health Research Lead for UCL Global Business School for Health. I also work with Ulster University within the College of Medicine and Dentistry, and I'm the Chief Medical Strategy Officer at men's health company Numan in the UK, and previously used to be the National Director of Digital Development for the NHS in England.
A true patient journey pioneer, been spearheading a completely new approach to digital transformation with a focus on patient needs, really. So before we get to our questions, what does a day in the life look like for you today in your current role?
Well, at the moment, in my main work within Numan, every single day we're trying to solve the problem of how can we help men access healthcare through an online mode of accessing healthcare, and how we put the controls and powers back in the hands of the citizen. And where this comes from is the fact that inequalities are widening, that everyone in society is suffering different aspects of poor health. And one of the things that we struggle with globally is access to healthcare. The demand for healthcare totally outweighs the supply that's available. The gates that we have in place mean that healthcare is not as accessible as we want it to be. So we need to do more to help the citizen take control of their own health and to be able to seek help in a way that is meaningful for them and is engaging for them. So every single day, we're trying to solve that problem. A little bit of my week, normally at the weekend, goes into teaching and research with UCL Global Business School. And there we deal with a different set of problems. We're evaluating digital health services and products. We're working out new ways of figuring out if something does or doesn't work, and teaching students from around the world as to why digital health research is important and why it matters to the issue that citizens are facing when we think about accessible healthcare. And to give you the context, there are 380,000 plus digital health apps and services around the world that are citizen facing. But can you imagine that only 5% of those have multi-million downloads, are in use frequently, or let's say more than once every day? The vast majority are hardly used. So why is it? Why are these things being produced to solve a problem, but why aren't they being used? And why aren't they solving the problem of access to healthcare and improving outcomes? So every single day, that's the sort of problem that we're trying to solve. And that's why the team at Numan and I have focused on dealing with problems that are clinically important, practically important, and emotionally important. The problem that we're trying to solve at the moment, the one that I'm really excited about, is the whole issue of obesity, weight, and weight loss. It's a difficult area. It's a taboo topic area. People don't like talking about it. Most people struggle with the whole issue of weight, being overweight, and obesity. It's a global problem where societies around the world are struggling with the same issue. It's something that's stigmatized, both by clinicians, but also by other people. The whole concept of fat has been turned into something which is not only a taboo, but is a topic that people avoid. And historically, clinicians, especially doctors, have referred to the problem as, well, sort out your diet and exercise. But why is this exciting? Because we now know more than ever that this condition is a spectrum disorder. It's made up of lots of different things. We also know that there is a whole biological component to this, that means that it is not simply about diet and exercise, but it also comes from the biology of an individual that makes them more or less prone to gaining weight. And we also know that there are different ways of tackling this through a combination of medicine, diet, exercise, sleep, in combination that might follow someone for their entirety of their life. But why am I excited about it? Well, we know that a digital health model and a digital method of behavior change could truly help solve some of these problems when combined with medicine and advice. So that's the thing that gets me excited at the moment. And the use of GLP-1 receptor agonists as a combination, a type of medication that combined with diet, exercise, lifestyle is a really important way that we can help solve this problem for many people around the world.
These are like new facts that I didn't even know, really. So it feels like I've been very narrow-minded till now. So thank you for opening my eyes to that and for our listeners. And you offer the digital coaching service for weight loss. How effective can coaching really be without physical presence? What other areas in our lives do you think we could and should digitize? So first, walk us through the digital coaching for weight loss. How does that look? What is Numan doing to really push that along? And then we'll get to other aspects of life.
Well, if we think about something like coaching, it pretty much relies on an interaction between an individual and a coach at a point in their behavior change journey when they may want to change. So they've gone from thinking about something to doing something. And the first step is setting goals, understanding an individual and setting goals. And the role of the coach isn't really to do something for the individual, but to provide sufficient challenge, hold someone to account, and help encourage them to make that change. Now, the one thing we do know is change isn't uniform. It might stay for a little while, it might go away, it might come back. And the role of the coach here is not only to challenge and support someone to achieve the change, but also to be there when they want to re-engage in that change. So they're the principles, the sort of model that we take. But why does this get interesting at Numan? Well, we've sort of taken the principles of classic coaching. We've taken everything we know around the evidence base for digital behavior change, most of which came from other sectors and other areas. And we've put the two things together to create an experience which takes us through a clinical journey where someone can have an interaction with a clinician to understand why they might need to lose weight or not and what's available to them. Understand the digital components, how we help them with goal setting, reward, and all of those things that we can do through a digital model, and then take the best features of coaching where someone can still interact with an individual, a human, but through a lens and through a modality that works for them. So for example, an individual in today's day and age might want to interact with a coach through chat or through SMS. Well, we make this possible in a way that wasn't possible before. So it's all three of those things are part of our model, one of which is the coaching, but the other two parts are the digital behavior change and also the clinical advice part as well.
So it's really a hybrid approach. It's an online and offline approach. It's a digital and in-person approach or via chat. Whatever works for the consumer. Again, your consumer-centric approach really taking place here.
Exactly. And this is the main sort of tenet of what we do, which is it's asynchronous and synchronous, taking the sort of digital modalities of rewards and awards combined with the things that also matter to people, knowing on demand when they can contact a human being as well. It's both of those things. And the reason we've sort of gone for that is there's no one size fits all. There are some things that work for certain people better, and there are other things that might work for others. And it partly depends on our own experiences. We've all experienced different things in life. Some of us are used to online banking and online retail. Some of us are used to perhaps online shopping. But not everyone necessarily uses online healthcare in the same way or even views it as online healthcare. So the important thing here is to create a range of experience which blend getting active support from a coach or a clinician, combined with some of those things that might be supported through prompts and automation. It's a combination of both, and hybrid or tribrid.
I love that, tribrid. What is an example of a reward? Just curious.
Well, we all see this in our lives right now, where you might perform a certain action or do something, and we're reminded of achieving that goal. I often see it with my watch. I have a smartwatch like many of us do. And when I've made sure I've hit my steps or my exercise goal, it gives me a little sort of signal or an award to tell me that I've hit it. The same thing tends to happen when I sleep or when I eat something. If we can blend this as part of a digital coaching offer, and this is part of the digital behavior change, those things help motivate us. It's a great example of positive reinforcement that might encourage us to carry out the same behavior again. There are also times when we don't feel like doing those things. I certainly have it. There are days where I don't feel like getting up to go training in the morning, or I don't feel like going for that walk. Sometimes we want to reach out and have that chat with our coach, get that extra bit of motivation that might help us do that thing. So it's a combination of using those rewards when they matter, but at the same time recognizing that we sometimes just don't want those things and we want to contact the person.
Right, right. I know I still would like to speak to a person, but
Right.
also have that digital, accessibility. So it's really just about the digital literacy of your patients and customers and seeing what size fits them.
And that again is important because that's an example where in this model that we have, of course, we recognize this works for those people that can access digital services and know how to use digital services. And certainly in the work that we do, we recognize that this model is only accessible for certain parts of the population. In some of the other work I do on digital poverty with the Digital Poverty Alliance in the UK, we're trying to tackle the issue of digital poverty and digital inclusion. How do we make digital services more accessible for a greater part of the population, both in terms of the affordability of digital access, the digital literacy and skills that people need, and making services more digitally inclusive? Because we recognize that services such as those we offer in Numan are only available to certain parts of the population. But in most parts of the world, we also recognize that digital penetration is not uniform. Take a place like the UK. We might have 94, 95% digital penetration as a country, but that varies greatly. London and parts of the north might be very digitally penetrated. But I know parts of Wales in the UK have very poor digital access. So the internet is very, very poor in those parts of some parts of the country. And so we recognize that at the moment, services are not uniformly available. And one of the things that we do through the Digital Poverty Alliance is help lobby policymakers to help improve digital accessibility.
Which leads me to my question, what measures should health system leaders take to make drastic and sweeping improvements to address these issues that you're naming now? I mean, what are 2 to 3 that we should keep as top of mind?
Well, historically, in most healthcare services around the world, we typically used to measure activity, maybe even output as an activity output. We used to measure access by numbers of people accessing services. These were classic measures that we all have used in healthcare services. But in today's day and age, that's not good enough. We need to start measuring ourselves not only on those forms of measure, but also digital accessibility as well, I think is equally important. We should be considering digital penetration. We should think about number of people that are using our services, not only the number of people downloading an app, but how are they staying engaged? How are they using it? And the thing that excites me most that colleagues around the world have also sort of thought about is how do we measure patient-reported outcome measures, patient experiences, to then improve those services as well. So not only the volumes of people touching a service, but how they're using them, when they're using them. And the great thing about digital services, there's so much to learn from other sectors. If I think about when I used to be in retail many years ago, we used to consider how long were people hovering on a certain page? What were they clicking on or weren't they? How did they flow down the funnel? Well, the same type of user-centered design can apply to healthcare. And we should be taking those principles and thinking about how do we get the benefit in healthcare as well. If we know we want someone to act and behave in a certain way through an online flow, whether it's an app or a website or anything else, even on a telephony flow, we should be considering all of those metrics. At what point do people drop off? Why do they drop off? What makes something frictionless? What adds friction? And then change those things. So those are some of the things I think we should really start measuring in healthcare that currently we're not very good at.
We have a lot of homework to do and a lot of other industries to learn from. You mentioned website, and I do want to go down this rabbit hole. One of the things I love about Numan's site is the way that you've been able to kind of consumerize and deliver medical care in very attractively bundled packages, right? So visiting your site almost feels like an online shopping trip to ASOS. Nothing really health related, right? So what was your thought process when you were working on this? What elements do you think could carry over to more traditional healthcare organizations?
It's really interesting, especially for me coming from a public health background. Classically, we design things from a clinical healthcare perspective. Healthcare services like to feel medical, like to feel like they're healthcare. Even our public health programs, generally around the world, designed from a healthcare practitioner, public health sort of perspective. This is great. However, it's not the sort of thing that resonates with the everyday person. People want things that they can identify with, language that means something to them, a call to action that relates to the problem they're facing. So the creative team that we have, certainly at Numan, is an in-house team, and they come from a creative sector having worked on things that are meaningful to people in many other sectors. And they're the principles we operate by. What is it that means something to the everyday person that'll be helpful for them? And that's where our mode of action really comes from. And that's really where our call to action comes from. And it's designed around the person and things that mean something to the everyday person to deal with the stigma of healthcare, the language that we use so that it remains accessible and appropriate to the everyday person, and making something frictionless when they're in that journey, that consumer experience. How can we work out at every single point what is more likely to help somebody get to the end point? And for me, that end point is someone engaging in their healthcare and working out what their problem is and helping them on their journey to solving it. But first of all, we need them to get to us. And historically in healthcare, that's been a bad thing. If I take my own clinical services in my physical practice, it's really difficult for someone to book online. It's full of lots of friction. If I think about when I was in the NHS, something as basic as registering with a doctor is impossible. They have to physically go in and deal with those things. But at Numan, we've tried to address those. Try to make it as easy as if someone's shopping online or buying online. We've still got all the safeguards that we have in a healthcare service with clinicians on the back end, with lots of safeguards to make sure that people are looked after following the right protocol. But all of the early part of the journey are how they find our site, they travel through our site, they manage to go through an online consultation flow, and when they get through to that service, how do we go through that process to make sure they get the right treatment for them? All of that we've simplified. And that's the thing that I love working with our creative team and our growth team, who do a great job of taking the best from every other sector and bringing it to healthcare.
Covered all of the touch points necessary to make it a frictionless journey. And one of our previous guests said something so simple but so smart. Healthcare needs to get out of its own way, right? And it's time. This is really time. This is the digital revolution. We've been saying this for years, but I feel that this is specifically the time. You even spoke last year, I think, at HIMSS 22 in Europe, correct? You spoke about how digital health startups have a huge opportunity to actually revolutionize the way healthcare is delivered, like Numan is doing. But if this trend is going to continue, then they'll need support to receive throughout their journey to make sure that they survive in the sector. So if they don't, they run the risk of being very frustrated, right? The risk of innovators being frustrated by the endless number of barriers that will enable their businesses to grow. So what do you think needs to change today, realistically, in order to help them thrive?
So many things. But the most important things that we need to change is, first of all, improve the transparency of regulation in the digital health sector. We need to help government decision makers, policymakers, and regulators understand the nuances of a digital health service that might be very different to a physical service. That's kind of the first area. And they need to be able to work at the same pace that the many startups and innovators are operating at. That's not always easy. Having come from government and having worked with governments around the world, that can be really challenging because governments often don't operate at the pace of startups. So that's the first change I'd be looking for. The second is the reimbursement model. That also has to catch up. Patients and the public are demanding far more from online healthcare. But whether it's an insurance company, whether it's an HMO, whether it's a government agency, they very rarely catch up on the reimbursement model to match that level of demand and recognize the benefit of doing so. And the third area is also providing the follow-on support, whether it's from investment vehicles or otherwise, thinking about how we value healthcare and digital healthcare providers in a slightly different way, so you recognize the long-term aim of what it might be to help and support patients, which themselves are the whole reason that a startup, a scale-up may survive and in the longer term be revenue generating. The other area which sort of goes alongside this in healthcare is not only the regulators, but the wider ecosystem. What does collaboration mean? What does competition mean? And really coming to a point where we recognize that both can coexist. They can't always exist at the same time, but it's important that the online and offline worlds can work together.
Where do you think global health systems will be spending their tech dollars in the near future?
Well, there's where I think they'll be spending it, and there's where they should be spending it. I suspect where they will be spending it will be where pretty much every health system spends its tech money, which is on EHRs and EPRs, on electronic health records and electronic patient records, is probably where it will spend its money, and on back-end health tech, which is classically where most health systems around the world spend most of their technology spend. Where I think they should be spending it, though, is on those things that reduce the burden on clinicians, and even more important than that, reduce the burden on patients. Because if we're going to see the efficiency, the productivity, and the gains in healthcare services and healthcare provider organizations around the world and reducing the spend, we need to spend far more on those things that have a public health benefit, i.e. those things that take healthcare into the hands of a patient. But I'm very doubtful that most governments or spenders around the world, or payers, are going to do that anytime soon. And I suspect we'll still be spending most of our money on EHRs and EPRs.
It almost feels like one can't have a conversation these days without mentioning ChatGPT. So I said it, ChatGPT. I'd love to hear your thoughts on the future and potential of these massive language models, and also what are the risks involved?
Well, first of all, I'm glad you mentioned it too, because I've been reading a lot about it and talking to many people about it, our own team, colleagues, and it has clearly caught on in every sector, including healthcare. In healthcare, I think it's interesting because it's helped the creative teams in healthcare build content in a way that is probably easy to pull together and easily utilizable. In healthcare provision of services, it may also have a role in helping speed up and provide support to creating everything from a response to referral all the way through to standard content for notes, letters that happen to go out. But there's also a risk in that we assume that one size fits all, and it all depends on the quality of the question asked as to what sort of answer comes from these large language models, of which there are now many. But I certainly don't see it going away, and I think it will continue to become part of the future of healthcare. But herein comes the problem. Well, the first issue is patentability. Originally, when we had this type of technology, it wasn't necessarily patentable in its own right when it first came about. But now what we're seeing is where it relates to the underlying change in structure, architecture of technology, it is highly likely there will be a patentability issue that comes out. Certainly in global healthcare, this is a problem that needs resolving. I'm sure many lawyers will pore over this. But there's a second area of intellectual property in healthcare, one that really needs thinking through, and that is the problem of copyright. Most of these models are scouring, scanning, interrogating large databases, most of which has content that is already copyrighted and that may not have been licensed. So when an output is created in whatever form it is, text or otherwise, it's being based and built off other content that somebody else owns. And then the question is who owns the product, the output from the large language model? Well, classically, it will be the originator of the first item. So no one has really thought through what this could mean in healthcare, because when we're working globally, when we have published material coming out of journals, when we have academics and researchers, when we have many other health tech organizations that publish online, where and who owns this? And at what point does this originate and get owned by data coming from a patient? So massive potential in, of course, using the capability, but we still need to think through the liability around using it. We need to think through the patentability, the other IP areas of copyright, and we also need to consider what happens when something novel is produced or appears to be novel, but actually relates right back to where it came from. So some sort of interesting things emerging from it. It won't go away. And yeah, very much look forward to seeing what happens next with it.
Does it excite you that it came around, or is it more of a cause of concern, specifically when it comes to healthcare?
Super exciting. Super exciting because, one, people are engaging with the topic. They're asking questions. It's not that different to going to a major global search engine, putting a question in and scanning all the answers. It effectively is doing that, if you like, at super speed, which suddenly makes it interesting. Now, as long as we can do it in a way that's useful and beneficial to patients and the public, a way that's safe, and a way that actually can make a difference, then I think it's good. It's going to need a few safeguards, and we need to think about what those safeguards are, but it helps people interact in a way that they may not have done before, and it might help with self-serving for certain conditions.
So we've reached my favorite part of the episode, which is the Let's Get Personal part, just to get a sense of your personal insights on life in general, career in general. What is your secret sauce for success, career advice that you've been given that stuck in your mind?
Do you know, once upon a time, somebody said to me, be militant. And if you believe in something, be militant about it and sort of go for it. Don't hold back. And that's the first thing that still sticks with me. And I still know the person well that said that to me. It was one of my first managing directors for a company I worked for. And that has very much stuck with me. And I've continued to sort of follow that, which is where I can, where it's useful, be militant to get the outcome that I need for either me or whatever it is I'm working on. And that's probably helped with success. The career thing is super interesting as a question because I get asked this all the time from people that want help, want advice. And there's one thing that I sort of stick by, which is do the thing that interests you. And when it stops interesting you or you can't change it, move on and do the next thing. And I've never really sort of had a complete plan. Once upon a time, I had a plan to be a clinician and just sort of do that. And then I realized that actually as interests come along, it's helpful to be able to pivot and change and follow those interests. And the main thing is feel like you're progressing, have some sense of achievement in what you're doing and enjoy what you're doing. You have to enjoy it and keep enjoying it. And when you need to, add something else in there, throw something else in the mix that keeps things interesting. So yeah, be militant, but also make sure that you follow the thing that interests you and do something because it adds value and it changes you, it enriches what you're doing, and the success sort of follows.
And if you could name your passion in a nutshell.
Make a difference. Just make a difference. And I often think about where else would I want to make a difference if it wasn't doing what I do in healthcare. The next thing is probably some dimension of law and rights, because it kind of naturally follows what we do in healthcare, where in healthcare we try to make a difference to people from a health perspective. But so much of it is equally applicable in people's lives in society. So the next area would be to make a difference somehow and somewhere through the lens of law. And if it wasn't that, it'd probably be through some form of making a difference in social campaigning of some kind. So yeah, I very much am all about helping the underdog and making a difference. Much sometimes to my sort of family's discontent, where I'm trying to work out and solve the problem for someone else that comes along. But it's great. It's nice to be able to do so.
Sam, if you were to walk into a room, which you probably do as a teacher, but if you were to walk into a room filled with 100 new CIOs, Chief Digital Innovation Officers, Chief Information Officers, digital healthcare executives entering the space today, what would you like to leave them with?
First thing is why are they there? What are they there for? What do they believe in? And keep on asking the why question in every room they go into. When they're in that room, they've got to ask, where are the others? Where are the people they can't see? Where's the problem they can't see? What is it that's not in front of them? Because that's the big thing they're going to solve in healthcare through the use of technology. And that's how they're going to reduce inequity of access to healthcare, and they're going to solve inequalities. But they've got to be prepared to ask about what they can't see and be prepared for the answer around what they can't see. So that's the thing I'd love for them to understand. So they remember that they've always got to solve not only the clinical need, but the emotional need and the practical need as well. Ask about the why question, why they're there, and make sure they challenge themselves and everyone around them for the people they can't see.
And Sam, at this time, I want to thank you so much for the time that you gave to us. The insights that we've heard today were just thought-provoking and mind-blowing, and I want to thank you so much for your time. I hope you enjoyed as well.
I really enjoyed chatting to you. Thank you so much for having me, and really looking forward to seeing you in person soon.
Likewise. Thank you so much.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.